So the Michigan Long-Term Care Ombudsman strives to improve the quality of care and quality of life for residents of nursing homes, homes for the aged, and adult foster care homes. The program has 20 local ombudsmen located throughout the state, and these ombudsmen make frequent visits to facilities and work directly with residents to resolve their problems. Ombudsmen use the knowledge they gain at the local level to educate policymakers and the public and promote improvements in the long-term care system. Our program is funded by federal and state government. There's never a cost to residents or families for ombudsman services, and our services are confidential. We work on behalf of the resident, and we help become the resident's voice. So when you might want to contact our program, if you have concerns about care, the quality of life, payment issues, or eligibility issues in a licensed long-term care setting. If you have questions about your rights, if you cannot get the services, equipment, or supplies you need, if you're notified that you have to leave the facility against your wishes, if you want information about other long-term care options, maybe you don't want to live in a nursing home for the rest of your life and want to consider other placement services. Or if you want to learn about becoming a volunteer within our program, or if you wish to schedule a presentation about long-term care issues, our ombudsman can offer services in all of these areas. So typically, our ombudsmen visit nursing homes on a regular basis and meet with residents and try to address concerns or issues that they have. But since March, we haven't been able to go into facilities due to COVID-19. And I wanted to share with everyone today that during this time period, we've seen almost a 95% increase in our call volume. So there are concerns and issues out there for many residents living in long-term care settings. The most frequent concerns that we receive are related to visitation and isolation and quarantine, which all of you can imagine being isolated in a home to your room and only seeing the people who care for you each day. So as I chaired this quality of life subcommittee work group within the task force, we did focus on these issues about isolation, about the need for visitation, about how residents can become depressed and they can physically and mentally and emotionally decline without having family and friends available to them. And then we also think about the number of residents who don't have community from the outside and oftentimes rely on other residents to be their support. And they've been isolated from them as well. So I wanted to share with you that we've made a number of recommendations, and most recently we have seen the Department of Health and Human Services release an epidemic order, which does allow for outdoor visits, which haven't been allowed in the past. And it also allows for certain service providers to now enter the facility and provide those necessary services like mental health services, podiatry, dental, different therapies. Those are critical to residents. And initially, maybe a month or two, you might be able to delay those services, but we're now 6 months into this pandemic. So it's really important that those be allowed. So I only have just a short time left with you today. So I did want to mention that our website, mltcop.org, has information about COVID-19 and how it affects those living in long-term care settings. We also host a Wednesday night call from 6:30 to 7:30 where people can ask questions, and the information to access that call is on our website. And if anyone out there is in need of assistance from a long-term care ombudsman, we are just a phone call away. And our number is 1-866-485-9393.
Could you give some examples of when a family should contact you, particularly if maybe things aren't working out in the long-term care facility, or they're nervous about protocols and how they're handling COVID? Could you just talk a little bit for the audience, talk through some scenarios that would be appropriate to contact you?
So if your loved one, if you're noticing a decline and that your loved one is either losing weight or you're being told that they have to increase their medication significantly, or your loved one, is more agitated, depressed, those are the times when if you've talked to the facility about those concerns and they aren't helping address it, that's when you'd want to reach out to the Ombudsman program. We might be able to help you have a conversation with the facility about meeting the residents' needs and the requirements for highest quality of life. And that might help us facilitate maybe an in-person visit or an outdoor visit and help support the resident who's really at that time we think suffering from a decline. We also know that if family members have helped in the past with residents with perhaps with their dining and you've supported them, there are some flexibilities that would allow a family member to continue to enter the facility at this time and support your loved one with the dining program. And we never want to see weight loss with our elderly. It's often that leads to other deteriorations. So those are some examples. Or if you're told that your loved one has to leave the facility and you're not given a written notice, that's a time to reach out to us. If you are concerned about abuse or neglect, reach out to our program. Or if you're just concerned overall with the care that's being provided, one of our more common complaints that we hear in our program are if call lights are left unattended and not answered timely, or they're turned off and ignored. And we understand that staffing is always a challenge for facilities, but residents shouldn't have to bear that burden. They deserve the care and services that they're entitled to. So almost any reason you could reach out to our program and we would try to offer assistance.
What are the requirements for outside visits? So what are the guidelines around that?
There's actually a significant number of requirements, but I think what's most important to know is that the facility has the option to offer them. They're not mandated. They're allowable. What has to happen, the family member, if they're allowed to have a visit, they have to be screened. So when you come to the facility, they'll ask you questions about your possible exposure and if you've had a fever, any symptoms. You'll have to wear a mask. You'll have to stay 6 feet away from the resident. For residents that are COVID positive, they most likely will not be able to participate in an outdoor visit. They'll still be cohorted within the facility. The visit has to be monitored by a staff member or a volunteer who's been trained in infection control practices. So again, if a family member feels like there are barriers that could be resolved, reach out to our Ombudsman program and we will try to talk with the facility and find creative solutions. That's what's needed right now more than ever, are those creative solutions to remove those barriers so that we can reunite residents with those individuals that are so important to them.
What are the requirements of nursing homes to contact family members when there is a decline or other concerns of staff?
If the resident is experiencing a decline, that would be a change in their condition, and the facility is required to reach out to the legal responsible party. So usually that is a family member in that situation. There is no requirement for the facility to notify family members if they have staffing situations or staffing issues. So that is of concern. So oftentimes the way you learn about those is by a resident sharing their experience, and then looking at the root cause analysis, you realize that's due to a staffing issue in the facility.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.